professor, physician, epidemiologist. I am Dr. Sri Banerjee. Hello, everyone. I'm Dr. Sri Banerjee, core faculty for the College of Health Sciences and Public Policy at Walden University. And today I'm going to be discussing about a technique that actually has uh, ancient historical relevance. And the reason I'm going to be describing about this is because it really is, to me, it's really interesting to look at a topic from many different perspectives and used a technique to try to understand different types of disease conditions. So let's try this approach today. Usually I present a disease condition and then I give you various examples of that disease condition. I also have taken the approach of providing you with an epidemiological study design, for instance, like a cross-sectional study design in Science Direct, and provided you with all these definitions. So today I'm going to try something called trepanation. So what trepanation is, it involves the opening of the cranium by the removal of a disc of bone from the skull. And let me tell you why I got interested in this is because actually just yesterday I was at the Alamo, and when I went there, one of the rangers actually showed me a coin and some of the devices that were used for trepanation during the 1800s for the medicine that was current at the time. So this led me to think that this might be a technique that can be used to try to identify additional topics in research. But not only that, try to better understand this phenomenon. So first of all, on the left, we can start with the pathological condition self-trepanation, which involves the intentional removal of the neurocranium. And this was something that was practiced during Mesolithic times and during ancient times. And so here's some pictures and some examples of that. And also, there's circumstances under which amputations occurred in antiquity, which include punishment or accidental and war injury, surgery, and for ritual. So these were all reasons why the trepanation would have occurred. And so, or any sort of and any sort of amputation. So this is not just trepanation. This is looking at different types of body modifications. The next portion of this goes into decapitation, so we're not gonna go into that in too much detail. So let's look on the right, trepanation of the frontal sinus, and so trepanation of the frontal sinus. This is pretty interesting because it talks about using general anesthesia, and this is looking at sinus surgery in the present time. And sometimes in the frontal sinus, you really have no other way but to, because the periosteum is elevated, and so you kind of go in there and might drill a hole in the anterior cranial fossa, and be able to relieve some of that pressure in that fossa. So I'm gonna just flip back into ancient, just for a break. I'm gonna flip back into ancient trepanation again and tell you about 4 main techniques of trepanation that there was. And this is kind of interesting, so I'm going to go into this. So the one type was drilling using a trepan drill, but then scraping using an abrasive instrument was one, and then cutting using an incisive instrument, and then boring and cutting using a drill and an incisive instrument were the 4 ways that the operation was conducted. And of course, because this is ancient medicine, there was always the risk of infection, hemorrhage, and brain injury. But now, going back on the right-hand side to modern day, purulent secretions drained from the sinus should be submitted for gram staining, culture, and sensitivity testing. And so these are all very important. And then, of course, so sometimes the catheter is introduced into all of this. So these are all the different types of trephination. Trephination can, again, on the left-hand side, we have sinus example. On the right-hand side, we have the ability to actually help in glaucoma by trying trephination on the anterior chamber within the eye. And then there's mass lesions that they talk about, of course, within the head. When you have increase in cranial pressure or swelling within the brain, trepanation can actually help. But there's trepanation syndrome that occurs in up to 13% of patients undergoing DC. So this is something that needs to be, of course, also monitored as well. And so in this situation, this is when you would be using something like cranioplasty to aid with that. So just moving downward into trauma and treatment, some of these go into some interesting treatment, which you can take a look at. And these are not necessarily looking at the head. This one actually is looking at the femur. On the right hand side, we have some keratoplasty. So again, looking at the eye and pressure in the eye and how trepanation can be used to relieve some of that pressure. I thought that the one on the right was interesting, but also the one on the left about talking about how some of the most common type of procedure encountered in archaeological material was trepanation. And so historically, this was performed for cultural, medical, or spiritual reasons. This actually identified 5 methods: scraping, boring and sawing, drilling, and gouging, with differences in the amounts and depth that's of the bone that's removed. So there might have been some cranial trauma treatment as well. So this might have been actually a medical sort of application as well, rather than just potential ritualistic. But of course, death can occur due to poor technique. So this was found in northern Peru, actually in the cranium of a 7-year-old. And so there was a scraped trepanation that was discovered also in a sample of 18 adult skulls. So these are all, some of these different pictures show the trepanation actually within there, and so you can take a look. So then this goes more into within the left-hand side, on the left, 1744, going into ventricular puncture, trepanation. So this would be in the CSF drainage, so cerebrospinal fluid drainage would take place through craniotomy. So basically more types of trepanation that have been used over the centuries. So the idea is that when you're first starting to study diseases, when you're first starting to research about chronic diseases, infectious diseases, any sort of disease, you can go through multiple approaches. You can start from the actual disease. You can start from an actual symptom. Here I've just presented another way that you can approach a disease is that a technique. So you can use a technique to approach a research topic. I'll give you another common technique that's used, CABG, coronary artery bypass graft. That's a technique that's used for triple vessel disease, and see if that's effective or more effective than other types of interventions. So as you can see, this really gives you, if you know a procedure, then you can put in that procedure, search more about it, and search related sort of topics from that procedure. A heart catheterization, sometimes you can think about that. You can also think about any sort of any sort of procedure or technique, like an echocardiogram. So I've given you many examples here of techniques that you can just put in and then look for related topics. I hope this has given you more ways to approach understanding of chronic diseases. And you can explore this further within this website. Thank you for listening.